Ocala's information station, 1370 WOCA. Ocala!
All right, 5 minutes. 5 minutes after 11 o'clock. Thank you for tuning in. There might be something in this broadcast that will heal you. There might be something in this broadcast that will heal you. The information that we're going to hear will help you. But I read something that says that radio frequency sometimes can heal you too. Right? So maybe just stand near your radio. I don't know. In the studio, Leah Caruso is here. She's with Strive Rehabilitation. She does clinical operations managing over there. That's what it says. And Leah always brings us some great guests. And she's brought Dr. Ranjit Gowda with her before. And he is an American board-certified physician in physical medicine. Why is it American? As opposed to other countries, so you're all over the world, right? And also in the studio, Suzanne Santangelo, Director of Marketing at Ocala Health. And good morning, ladies.
Good morning.
How are you? I know you didn't want to be the star, but I got to say hi to you.
Well, thank you. I appreciate it.
Hey, Suzanne. And Leah, how you doing, Leah?
Good morning. Thank you for having us.
And Dr. Ranjit Gowda, good to see you again. You were here last time.
Thanks, Larry. Good morning.
And last time we talked about back pain. You know what I remember thinking about after you left last time? Is how sometimes you have a back pain and you can't really point to it. Is that unusual?
No, that's not unusual at all. Yeah, that's right. We talked about back and spine, the spinal cord and all the fantastic spinal cord injury and last time. But not being able to point to a back pain, a particular spot or level is not unusual because the body is designed, sometimes we can, but it's designed in different ways. For example, the skin in the hand or the lips in the mouth are the most richly innervated with nerves, and they're meant to localize the touch or a feel or a pinprick or a point very precisely. But the nerve supply to the spine or the deeper structures are different. Like say when we have a belly pain or a chest pain, we can't exactly point.
That's right. Yeah.
But it's designed that way because the body only tries to localize as this is the part of the area that hurts. So in that sense, it's only trying to alert us to what is important to it. So for example, we have an L4 disc herniation or an L5. Basically, I'm talking when I say 4 or 5, meaning we have 5 low back or lumbar vertebrae, and we would just most of the time we could only point to my low back hurts. So we wouldn't point. You're right on that. But in the neck, we get a little more precise, and so it all depends on how richly they're supplied with nerves from the brain, and it's all designed with a specific reason.
It's amazing that you can figure it out when we can't even tell you what's wrong. I mean, I guess you have ways, huh?
Well, that's how we have thankfully, I've been taught the ways.
That's why he's American board certified.
American board certified. That sounds like a baloney, funny. Doesn't it? American, you know how you go to the grocery store and you see American? So.
No, American board certified. Well, I think one tries to designate that because each board or each country might have different ways of calling somebody certified or qualified. So it's just a standardization. And the funny thing is when you mention the American is actually carried through the rest of the world. So if I were to be in Singapore or Australia and you said American board certified, it would immediately call out to somebody
that's a nice
what their educational qualification level might be. And actually, it's funny that you bring that up. For example, if we were to go in a country that wouldn't have a lot of their own medical school, I'm trying to bring up, say, certain countries in Middle East or Saudi Arabia.
Chad probably has none.
Yeah, sure.
Just probably not.
Really, sir.
I don't know. Just
off that, and I don't want to make fun or light of it. But they would say a hospital in Saudi Arabia would go out looking for a doctor. Would say they might prefer to say like we would like to have an American board certified doctor for the same reason, or they could say it would be a German or Australia or Indian board. But I do know that American board certified carries through
a lot of ways,
symbolism of quality in medical care throughout the rest of the world. Would still be a preferred qualification somebody would hire, or I frequently see that come up top on the list.
So does pain always mean something is inflamed, or does pain always mean something is just fill in the blank? Is there a blanket statement about pain?
No, pain is not necessarily. It's about an uncomfortable or undesirable quality or sensation. So it doesn't necessarily mean inflammation in every case or situation. It is because we talked about this last time. There may not be an active injury certain times in a chronic case, or we brought up the specific example for example, somebody, World War II veteran who had frostbite might still hurt in the toe, and there's really no active inflammation today because this happened along. But yes, it would be an uncomfortable or undesirable sensation that evokes the emotion of discomfort in the brain, sort of thing.
So tell the listeners that are really wanting me to get to the chase. So there's listeners right now who go, would you please ask me what to do about my pain? So let's say there's somebody listening right now. What do you do for something? I guess first you have to diagnose what's causing it.
Correct.
And then is it a matter of changing your diet, changing your behavior, or do you apply? What is that thing I read about? The radio frequency treatment. What is that?
Well, it's very funny. We are on the radio, right?
I know. I'm hoping that we can help somebody right now.
It's just dialing into their favorite radio station. Sometimes fixes certain people's pain.
Yeah.
You know that.
Yeah.
So, no, radio frequency. It's one of the very specialized techniques, or what we call an intervention for the back, where it helps deal with pain. For example, in radio frequency, what exactly happens is an electrical signal, and it's called radio because it uses the same frequency as in a radio, but higher energy level. So this would be passed through a very small localized needle tip. So if we had a particular nerve, for example, in the back, that is the key, not a nerve that we would need for, say, walking or function, but a nerve that is purely just carrying pain signal, as in coming from a painful back joint. We put this needle, and it would send a very localized current there and deaden that painful nerve ending, and that way helping that person. So it's a sort of, used to be called rhizotomy or surgery, and would have required, before such a technology, for somebody to go in and open the back and cut this nerve ending if necessary. But in today's world, it's just sometimes just a local numbing medicine or local anesthetic in the skin, a skinny needle that goes in, but it's done under a very specialized technique.
Is it temporary, or does it last?
It is a very good question. Temporary or permanent would really depend on whether the person's primary condition for pain exists, and the nerve regrows back in about 4 to 6 months. We do know that. Doesn't mean a person's pain would return.
Oh, really?
For many,
that's good news.
That's right. And so it's a long-term treatment, unlike just a cortisone injection, a cortisone injection may last as well, but we do know a cortisone wouldn't last in the spot we injected, which we do also. It's called epidural steroid injections, or joint steroid injections. And many of us are familiar from the knee, hip, or shoulder. Right. But similar injections are carried out in the back or spine. I'm talking about all of these from a spine perspective. So the radio frequency was kind of, I would say, used in a widespread way in the back and spine. Now we're trying to consider whether this can be duplicated and used it for other joints as well in the body. Say, for example,
it's still in the experimental stage?
Well, in the sense of, could we use this to deaden or numb the knee joint nerves, or could we deaden a shoulder?
That would be good news for some people.
That would be, and it is being tried. The reason why it's such a proven and tested, and this is not experimental medicine in the back, is because the joints in the back have very precise nerve endings, that they have only 1 or 2 nerve endings that come down to them.
Oh, really?
And by deadening them, we would really help numb the muscle, or sorry.
Do you feel numb, or do you not feel anything?
Well, the numbness, beyond that day of injection where you have numbness from the local anesthetic, the question I generally ask or try to follow up when I see them back six weeks or a couple months down the road is, have you found relief of your usual pain? And so it's not a numbness as much as trying to remove the pain and discomfort a person had. So in that sense, it's a sort of numbness now because they were used to having some kind of a pain in that area. Now it's not painful. One could see it as being numb, but that's not the purpose of it, as being numb.
So is the injection the Band-Aid until you figure out what the real cause is to alleviate the pain that way? Or do you have to keep on with the injection?
Well, that's a very good question, Robin, in the sense that is this, Let me give you an example. We have what we call a normal aging process, though nothing's normal about aging. All the things we would have.
Nothing's normal about aging?
Well, it is normal and organic, but it's probably the
older I get, the less normal I am.
Most lethal condition we know of, 100% lethal.
Yeah, right.
But yes, all the processes are normal, but none of them are a happy, comfortable journey as most.
So far, mine's been pretty good. So far, my aging has been not too bad.
Well, everybody's aging is good, and
except when I look at photographs and I say, "Whoa, what happened?"
Well, everybody's heard about degeneration or arthritis, or something like my patients call Mr. Arthur is not acting well today.
Yeah.
And these come about.
I bet you laugh every time, right? You pretend it's the first time you heard the joke.
Yes. It's like, oh no, first time my ears put, who's Arthur? Then I suddenly realized what we're talking about. But degeneration, we call wear and tear, and the normal part of it is normal wear and tear is what we call. I mean, we expect this. So let's say we have somebody enough wear and tear, and this, by the way, it starts off as early as in the mid-30s to 40s in many people. So what do we do with the degeneration? That's uncomfortable and painful. And we would try to treat that with, we wouldn't reverse that with any sort of condition. And we do know there is replacement for the heart or the lung or a lot of other organs. But there's really no replacement for the spine. We're given what we have. And that's why when we have spinal cord injury, we cannot give somebody a new spinal cord or a new spine or whatever. We can fix it. So it's really probably one of those things that would go with the time we can all get a new brain. We would probably get a new spinal cord and with technology. But until then, so when you say would be completely fixed with an injection, or would somebody need this again? With arthritis or degeneration, we do know that condition that came with wear and tear will continue to remain. So, but trying to make it comfortable for as long as possible with as little injections as possible.
So if I was dying and they put your brain in my head, would you be living in my body?
This is a question.
Would you wake up and say, "Whoa, what happened?"
That's an interesting question.
Or I'd be gone. I mean, aren't
it's a question for philosophers?
My brain, okay.
And we could talk till the cows come home and not get anywhere on this.
We'll take a little break.
Thank you.
And we'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. Sunshine and building clouds today. Watch out for an afternoon and evening thunderstorm, the high 90 to 94. Partly cloudy overnight, low 71 to 75. Tomorrow, sunshine mixing with clouds, an afternoon and evening thunderstorm around, high 90 to 94. On Saturday, Independence Day, times of clouds and sun with an afternoon thunderstorm likely, the high 90 to 94. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Good credits, bad credits. It's none of our business because we're not an auto dealer. We're not a bank. We're not your mother. We're OcalaForSale.com. Marion County's marketplace for cars, trucks, and SUVs. We've got thousands of sellers standing by to take your call. No middleman. But hurry, don't walk, don't run. Just sit down and log on to OcalaForSale.com. Prices and inventory change daily. Offer does not include dealer upcharge. Undercutting, rust-proofing, factory surcharge, or delivery fee. See website for details.
Do you have areas that have started sagging or drooping? Is what you're looking at not quite the same as it was years ago? Are there enhancements you've been putting off? Is there serious damage you need fixed? Then call on us, Damage Control Services, when your roof is sagging and the drywall is drooping after a storm, or your home just needs some enhancements. From damage repairs to new construction, Damage Control Services is here to help.
All right, 19 minutes after 11 o'clock. Thank you for tuning in. Leah Caruso is in the studio, as is Suzanne Santangelo. Leah is with Strive Rehabilitation, and Suzanne is with Ocala Health, and Dr. Ranjit Gowda is in the studio. He's also with Strive. He is an American board-certified physician, and we're talking about back pain, specifically what we can do for some common conditions that result in pain. We've been talking about a couple of those things, and I guess I've been a little too silly, so I will straighten up. Do you know who you look like, by the way? Did anybody ever tell you you look like the actor? What's his name? Jeff Goldblum. Did anybody ever tell you that? No. Nobody ever told you look like Jeff Goldblum?
Thank you.
The guy.
You look a little little.
Doesn't he? Do you see it?
Does.
Yeah.
It's a compliment.
So
Thank
if
you for the compliment.
so we get older, or what happens? Why does our back hurt? When we get older, we shrink, right?
That's right. I just saw your. I mean, of course, the listeners cannot see what you just showed. You showed two hands coming closer together.
Right.
And you brought up a very important thing. I wanted to talk last night. I thought, what is some of the things that I do definitely want to review? And you said, as we age or we have degeneration, normal spines, as you showed with the two hands, they kind of come closer. What you meant was settle down. And the spine settles.
That's what I say to my dogs. Settle down.
It does settle. It does settle every single day. We are all taller in the morning versus at night because we are because the discs lose fluid in between. But that's not the kind of settling. We're talking about the kind of settling here where
that's because we're laying down at night. That's why.
Yes, people are taller early in the morning than they're at the end of the day because the fluid, and it's got to do with the amount of fluid and water in the discs and the connective tissue. The discs are the structures in between the bones that actually help cushion and also add flexibility to our spine. They lose their normal elasticity, they lose their hydration, and they settle down. They're bringing the vertebrae
as we get older.
Right, and brings the vertebrae closer, like you would imagine an accordion settling down. When that happens,
I can imagine an accordion.
Yes. When that sort of thing happens, like in an accordion, you know how there is the folds, they either fold in or fold out.
Right.
So and that's exactly what happens in a similar fashion in the body. The connective tissue or the ligaments in between have to either fold in or fold out as well. So let's imagine in a person where there's more folding in happening. So what do we have on the inside? In the inside we have spinal cord, nerve, and nerve structures. So they would fold in on the nerves.
Oh, and that's where the pain
narrowing. Comes. Right, and that's what we call spinal stenosis. So it is basically what would we do with spinal stenosis? What have people done over thousands of years is we have naturally hunched over or bent forward. It's in a way of stretching the accordion out at the back.
Okay, gotcha. Right.
And they say about the myth of the Sphinx is the Sphinx would ask the question to any weary traveler. I don't know what the punishment was, but I know the question was what walks on 4 and then walks on 2 and then walks on 3 legs in the end, 3 limbs, and the question was human being because we use a cane.
Oh.
We lean forward.
I thought this was going to be a joke.
No, it was. Well, we lean. It's coming. We lean or hunch forward.
Right.
And the cane is not only balance and coordination, but it's primarily people have adapted to the cane or 3-legged walking, we call it, because it helps us hunch forward or open this accordion back at the back and relieve the pressure on the nerve. So that's spinal stenosis. Surgery is rarely necessary or indicated, though one would think like, well, let's go in and open that place up. But it doesn't. It's only reserved for very limited cases. We do know it's not a practical solution.
So I want to tell you what I just pictured in my brain when you said that. Okay, so the bones in the backbone come together, right? And then some tissue gets squished in or out, and if it goes in, it's pushing against the spine, right?
Right.
So now something physical is happening causing that pain.
Correct.
Of course, we don't know that. We just feel the pain.
Correct.
So you don't cut that piece out or push it back in place because you probably can't, right? It would,
correct.
Would it be too dangerous or something?
Well, that would involve extensive spinal surgery. It's not a minor spinal surgery, and it's only undertaken in those cases where that narrowing is so severe. There's specific numbers, and I don't want to get into too much technical details of who needs surgery or not, but it really comes down to who has permanent spinal cord kind of injury or involvement. At that stage, we would be beg to question: is there a risk benefit? Would surgery be required? And so that's most people get spinal stenosis eventually, but not everybody needs surgery. We know that.
So in other words, there's a way to ease the pain without surgery.
Yes, there are ways to ease the pain, other than what one would already do with appropriate posture and positioning, and people already having discomfort with activity and function would. It shouldn't be written off as, oh, this is normal pain of aging, you have to live with it, because there are solutions to it. And we couldn't outlay all the detailed solution, but one would be where we could help with steroid injections in the back. They could be temporary, or we could try radiofrequency and help in posture or position the spine to a correct angle, which would be more long-term or permanent, as in 6 months or a couple years benefit possible from such a procedure. Would that need repeating? As Robin said, we do know that as science, it is considered such a procedure can be repeated if necessary down the road. Doesn't mean everybody would need a repeat, but there are many who might benefit from a repeat treatment. On the other hand, there is really no, these are all minimally invasive, just involve just local anesthetic, but it will be done under X-ray guidance, what we call a live X-ray or fluoroscopy machine. And this, people are familiar from a cardiac cath. The cardiologist would use a similar to see within the heart. And we have a similar setup at our Steroid clinic as well, where we have the fluoroscopy machine, or what we call a fluoroscopy suite. So when we do these procedures, we're actually visualizing for safety and for precision placement of the needle tip to exactly where it needs to be. And also to make these needles less invasive, skinnier, less uncomfortable. And with use of local anesthetic, the entire procedure doesn't feel. I mean, most people say, "Is it really over? Done with?" I thought most patients think that they were expecting more, and that didn't happen.
Oh, really? So it's a very quick.
There are many who have even actually gone to sleep without being put to sleep. That's a different.
But that would be me. I would just fall asleep on you.
Leah, did you have a question?
No.
Oh, okay.
I know Suzanne had something she wanted to mention before we ran out.
To say that we're really glad that Dr. Gowda is in the community now, and he's on our medical staff now. And why don't you talk a little bit about what you do on the hospital side?
Yes, this is at Ocala Regional, Suzanne. Thank you. At the hospital, I am on the medical. I'm credentialed with the medical staff as a physical medicine and rehab physician. I do work with the trauma team. I'm attending the trauma care conferences on a regular. And we kind of coordinate care. Of course, there's trauma surgeons, and there's multiple disciplines need to come together, neurosurgery. And it also includes, Strive has always helped all the trauma patients with physical therapy and occupational therapy. I join in as their medical director at the hospital now in further coordinating the care, adding value to the rehabilitation process, and helping the trauma surgeons getting patients healed up and going to the right place or location, as in an additional rehab or subacute care, nursing home, which is always the greatest challenge and the most.
So do you work in conjunction with the chiropractors, or is that a totally different science, or like for back pain specifically, I guess? At
the hospital, there are no chiropractors, but yes, as at the clinic at Strive, we do have a chiropractic physician on our team. That's Dr.
Andrew.
Kluger.
Yeah, we know Andrew. Yeah,
Kluger, yes, and we physical therapy, occupational therapy.
He looks like an actor too.
He does. He's good looking. I agree.
His mom watches when he's on.
And we do have what we call it. We want to introduce a very integrative approach to back pain, not just as different specialties dealing with the right arm or left arm. Trying to put it all together. So if when patients come in, doesn't necessarily mean they're ready for an injection or for surgery. It'd be like, what would they need? Physical therapy or strengthening exercises, and physical modification is always if not the first step, always an essential step. Anybody with any type of, not only back, but any type of, we call it a musculoskeletal, meaning to say anything to do with any of the muscles or joints and the entire system apart from the brain.
Doctor, we're close to the end, and I know we want to give out phone numbers and all that, but there's actually somebody calling in right now. If you put your headset on, we'll try to squeeze in a quick question from a listener. Good morning, you're on the air. Thank you for calling and for hanging in there.
Good morning. It's actually just a quick shout out to Dr. Gowda. This is Jan Marino from Palm Garden of Ocala, and Dr. Gowda is now working as a physiatrist in our center. We're so thrilled to have him. His expertise and energy are exactly what we need. And so I just wanted to say hello and welcome to WOCA, and that was it. Thanks very much.
Thank you.
All right.
Thank you very much.
All right. That sounds like you have a fan club out there. Do anybody want to give out phone numbers or contact information?
That'd be great. I just wanted to give out our consultant nurse number again, which is where you can get have any of your questions answered 24 hours a day, and you can also get physician referrals on this line. It's 800-530-1188.
All right. Suzanne, thank you for coming in. Leah, thank you for coming in. And Dr. Ranjit Gowda, always fun to have you in here.
Thanks very much.
Thank you so much.
Give me the opportunity. And Robin, too. So.
Yeah, make sure you call, because if you call us, we won't know the answers. You have to call Dr. Gowda. Thank you. We'll be right back. Did you want to say something?
Oh, I wanted to give the number for Dr. Gowda.
Okay, go ahead.
Yeah, for Strive Pain and Spine Center, the number is 352-690-7777.
Okay, thank you, Leah. I apologize.
You,
we'll be right back.
Gulf Coast states and the Justice Department for close to $19 billion. Louisiana's getting the biggest chunk.
More than $6.8 billion.
Louisiana Attorney General Buddy Caldwell. Texas, Mississippi, Alabama, and Florida are also getting billions.
Fox Radio's Evan